All right. This is Amy Landalt here with North Shore Acupuncture Center. And this is one of a series of videos that we've done about perimenopause and being perimenopausal in a pandemic. So we delayed this one a little bit because it really wasn't the time, I think, when we originally had this scheduled. So thank you, Dr. Mullen, for agreeing to wait on this. And
my pleasure. Yeah.
But the topic for today is to talk about hormone replacement therapy. So it's an opportunity for you guys to get a chance to get some of those questions answered. But let me tell you a little bit more about Dr. Mullen first and why I asked her to come and talk to you guys about this. So she has 20 years practicing medicine, but she's certified in integrative and functional medicine with dual board certification in family medicine and integrative medicine. So I just love her focus on functional medicine. And I thought that would relate well to the people that follow me. So for those of you joining us, and hello, I already have a hello from someone. If you have any questions about this topic, go ahead and put those in the comments. And I will try to incorporate those questions into the discussion that we have. And I'll ask questions as well. So we will just go ahead and get started. If you do have questions afterwards, if you see this and we're no longer live, you can still put the questions in and I can see if I can get responses for you on those as well.
Perfect.
So thank you, Dr. Mullen, for joining us on Sunday.
I'm so glad to be here. Yes. What a beautiful weekend.
Yes, it has been gorgeous.
Yes.
So if you could start just by kind of like giving us an overview even. So like what happens to our hormones during perimenopause or menopause? Like people talk about estrogen a lot, but it's more than just a change in estrogen, right?
Oh yeah. Well, a lot happens. It's a crazy time. So yes, estrogen is a big player because obviously that's a woman's predominant sex hormone, right? But what can happen in perimenopause is that estrogen can go high or it can go low or it can fluctuate between those two things, which is, the real fun one. But also progesterone, progesterone is the little known character in this play. But progesterone is a really important part, I think, of perimenopausal transition as well, because it's the hormone that is predominantly released when you've ovulated. And so when your ovulation starts to become really irregular in perimenopause or potentially irregular, progesterone is a big player in some of the symptoms. And the most predominant symptoms that I see a lot of are bleeding abnormalities, so heavy bleeding, irregular bleeding, sleeping problems, and mood changes. And that progesterone has a lot to do with those symptoms. But being estrogen deficient and being estrogen dominant also carry with them a whole host of symptoms. So it is a potpourri of interesting hormonal shuffles going on, not to mention the fact that testosterone's in there and cortisol from our adrenals is in the mix. So this is why I think it's really important for people to see a functional medicine physician or clinician and be evaluated appropriately instead of just kind of trying to shoot in the dark with this stuff.
Yeah. And so for those of us who are choosing to do this during a perimenopause in a pandemic, we get extra.
We're choosing to do
it and everything.
How are we choosing? There's no choice in the matter on both sides. Yeah, boy, what a hand to be dealt, right? Yeah.
So, what are some of the benefits of hormone replacement therapy, and what are the risks? Because I'll have people come to me that they're just nervous about doing something like hormone replacement.
Yeah, and I think we need to understand that hormones are on the spectrum of things that need to be considered for treatment. I focus a lot, and a lot of functional medicine physicians, especially at Vytal Health, focus on adrenal treatment because it is such a common problem. So adrenal fatigue or HPA axis dysregulation is an underlying issue for women to have hormonal imbalance and make their hormonal imbalance worse. So if you don't work on that, obviously it's a big deal. And there are lifestyle changes, herbal supplements, regular supplements that can be implemented and to a great deal of success before and in concoction, in concurrence, in concurrence with hormones. So it's not sort of an either or proposition as far as I'm concerned. But I think the most important thing that we use hormones for is management of symptoms. So we're not taking the stance of, take these hormones, you'll live forever, or take these hormones, you'll look 25 when you're 75. This is really about managing the symptoms. And if we can do that with other approaches like lifestyle, nutrition, supplements, great. But if we can't, these are quality of life issues for women, not being able to sleep, not being able to have, meaningful relationships with your family or your children because you're so grouchy and depressed and anxious, having terrible hot flashes. I mean, I went through that when I went through menopause, and it's very disruptive. I mean, you're in a Zoom meeting like this and sweat is pouring down your face. And I mean, it's awful. It's an awful experience. So it's really about managing those symptoms. That is the most important part. Now, there happen to be some other really great things about hormones, such as in women, it does have a positive effect on brain health. So I can't say definitively that it wards off Alzheimer's because that is a very complicated disease, but it does help with keeping our mentation intact as we age. It obviously plays a really important role in our bone strength as we get older. And it just really overall has a positive effect on a woman's cardiovascular health. We know that as women start to edge up on men in their 50s, as they transition into menopause, their risk for cardiovascular disease starts to become equal to men. And that's because of the loss of estrogen progesterone. A lot of people have the opposite idea in mind that, hormones are bad for your heart and your vascular system. And obviously we have to take some risk factors into consideration, but they're helpful for that. So risks, hormones of all types have different risks, and there's a lot of variation depending on which hormones you use. But I think the biggest risk that comes to mind is breast cancer or uterine cancer. Those are things that are real. They're small, but they're real. So we actually, really work through a woman's family history to make sure that she doesn't have any significant family history and make sure that she's being screened for those things appropriately, and that we're using the right hormones in the smallest amount to decrease the risk for that. Cardiovascular disease in a woman who smokes or a woman who has a lot of risk factors, hormones are contraindicated for that. That's not a good idea for those women. And I would say blood clots remotely, but again, those are really certain people, very, very obese women, people who smoke, would be at risk for blood clots. So we have to think of all of those things. But as a rule, they're pretty safe overall. They're, again, depending on which one you choose, they're pretty safe. So that's the good news.
I think I suspect that some of the concern around that maybe comes from the old types of things that were used in the past.
Yes,
that are
you're
very
right.
different than what is used today.
Yes, you're 100% right. I mean, those hormones are still around. The Nurses Health Initiative study, which came out in, oh my gosh, how long ago was it? It was probably the late 90s. And it was this study that just decimated hormone replacement therapy because, the pendulum just swung way over here. And the reason is because they actually used medroxyprogesterone acetate, which is the progesterone, it's synthetic progesterone that's very, very inflammatory. And they used the hormone that comes from horse urine, Premarin, as the estrogen. And they actually tested it in this study on women who had all kinds of risk factors, were older, were starting hormones for the first time in their late 60s, which most people wouldn't do. So it was a terrible study, but it took the whole medical community back 20 years. And all of a sudden, everyone became very afraid of using hormones. Those hormones are still around. I personally don't recommend them or use them. There are so many better choices out there now that we can use that have a lot less of an impact negatively on the body and just as many positive impacts.
Yeah. So we have Queen is acknowledging there's no easy list of how to deal with the adrenals that she's found. Right. And here's a question that you might not be able to answer in a broad answer, but how do you know which supplements and what combos and amounts to help the adrenals?
Oh, that's a great question, actually. So test. You can't know if you don't test. You need to do a 4-point cortisol, a diurnal cortisol pattern, typically done on a saliva test, along with a DHEA, which is another hormone that's important for adrenal function and hormone function in general. Those will tell the picture. And when you have high cortisol, low cortisol, depending on what stage you're in, depending on other things that are going on in your life. And it's not just about getting the right adaptogen or supplement. It's really focusing on how do we make the lifestyle better? How do we deal with the stressors? How do we manage this in a way that's comprehensive and, really addresses the person the individual person that's dealing with this. But yeah, it's really about seeing where you're at and then addressing it based on the testing.
And that testing, normally you would need to see someone that specializes in functional medicine.
Absolutely. Oh, you're absolutely right.
You go to your primary care physician.
No, this is not a primary care thing, nor is it a traditional endocrinology problem. Those are very black and white solutions / problems. We're dealing with the gray. But, it doesn't matter to me whether they believe in it or not. I've been doing this for such a long time that I can see when you positively impact people's adrenals, they feel better and their hormones function better.
Okay. We've talked about some of these other questions I had. What is the difference between bioidentical and synthetic hormones?
Yeah, that's a great question too. So bioidentical hormones, and it's a little bit of a misnomer because they're really biosimilar. They're not exactly the same as ours. They are derived typically from plants, so sometimes soy, sometimes sweet potatoes, and they're hormones that look, in terms of the structure of them, exactly-ish as ours. So when they plug into our own system, they tend to be they just sort of fold right in because our body is used to seeing those hormones circulating around. So they have the function of our hormones. Synthetic hormones are hormones that are manufactured from other places. And I mentioned earlier, like Premarin comes from a pregnant horse urine. They take all of that estrogen that the horse is spilling in her urine, and they siphon that off and make the drug out of it. Those look different from our body. And so their function is going to be the same in the sense that they're going to plug into the receptor for estrogen and manage some of the symptoms. But there's other effects because they're shaped differently. There's other effects that they're having on the body. So the closest we can get with the hormone structure to our own, the safer and better tolerated the hormone is. And typically we can use lower doses then of that hormone.
Okay. And so what happens if you've been on hormone replacement therapy as you go off? Like, is it like other medications? Like if you're on depression medication where you have to do it gradually and you can have a lot of side effects, or what is that like?
Well, you mentioned depression medicines. Now, depression medicines is a pretty broad category, so there's a lot of depression medicines that when you stop them abruptly, you do just fine, and others that are classically associated with discontinuation symptoms. So it really depends on the medication. With hormones, I think the same is true. It really depends on what hormone, what dose you're on, but it also really just depends on the person. I have had anything from women who just stop the hormones one day and go about their business and never look back. And I've had other women who, when they even dial it down a little bit, they have slight return of menopause symptoms. They have to sort of gradually back away from it. So there is no rule here, unfortunately. You have to sort of take it on a case-by-case basis. But I think the bottom line is it's not a painful process to go off of hormones like it is. I think if you've been a person who's been on those types of antidepressants, that can be pretty tough. This isn't like that. This is a different process and generally is quite well tolerated.
Okay. So one of the questions I've gotten is we've had a series of these, and we rescheduled the one about sexual wellness. So we might have covered this before with her, but we haven't talked to her yet. I get a lot of questions about vaginal dryness.
Yes.
So would hormone replacement therapy help with someone that's experiencing that?
Typically, hormone replacement therapy that's taken orally or taken through the skin. So bioidenticals can be made into creams and pellets and things like that are actually put in the skin or placed on the skin. They tend to not have as good effect on the vaginal symptoms, even though there is systemic absorption. People still typically have vaginal symptoms, even with the administration of those hormones. So those hormones would be great for things like hot flashes, insomnia, mood changes, some of those types of problems. For vaginal dryness, I mean, obviously we try to go with non-hormonal approaches first, using lubricants, really exploring that whole realm and just seeing if replacing the moisture is enough. If not, then you can actually use vaginal DHEA capsules. That is another very successful way that women treat vaginal dryness. And then obviously the whole sort of estrogen realm, of which there are estrogen tablets that you can insert vaginally. There are estrogen creams, and the estrogen creams can be different. There's different types of estrogens. Some are a little safer than others. But bottom line, I think most women who have severe symptoms, they end up using some form of vaginal estrogen to manage that. Thankfully, it's not something that you have to do every day once you establish the vaginal health again. It's something that you can do once or twice a week and usually have great success.
Okay. Do you have recommendations of certain types of lubricants that are more natural and, because there's a lot that's available?
There are. I wish I had the names off the top of my head, but what I try to look for are non-petroleum based, no parabens, no phthalates, no colors, no scents, and organic if possible. But even things like you can even use things like olive oil successfully, or other types of oils, essential oils, jojoba oil. Those types of things, as long as you're not concomitantly using a condom for contraception, because obviously those oils can break down a condom. But those oils can be very, very helpful for people. Good old fashioned KY, even though it's not considered natural, does a great job. And even just water, sometimes just water is enough to replenish some of that moisture. So it doesn't have to be extravagant. You don't have to go search the ends of the earth to try to find it. Just, trying different things can sometimes be really helpful.
And again, this we probably would have covered before, but I'll give it to you early, is if your clitoris or your breasts are less sensitive, is that hormone related?
Can be, yes, can be. Now, what really, really helps with that is continued touch. So actually restoring blood flow to the area. So a lot of women go like, okay, well, I don't have as great a sensation, I give up. And that's exactly what you shouldn't do. Continuing masturbation, continuing sexual activity so that you do have stimulation, and the blood flow is key. But yes, hormones can be very helpful with that. Both estrogen, progesterone, and even sometimes in some women, testosterone can be helpful with those as well. But continuing to use is the key.
Yeah, in medicine, we talk about the importance of continued sexual pleasure is important for your health.
Absolutely. Yeah. On so many levels.
Yes.
Yeah.
So Queen just mentioned that coconut oil is great as well. She was just
I forgot about coconut oil. Good suggestion. Yes, love coconut oil.
Is good for everything.
It's great. Just put it all over you.
Yeah. Lizzo has a song about coconut oil that I love because she's
right.
It's basically saying my mom taught me all you ever need is coconut oil.
I mean, pretty much, right? That's pretty much all you need. Yeah.
Coconut oil and water, you're good for life.
Exactly. Right.
If you guys have other questions, feel free to put those in here as well. Are there key things that I haven't asked you about that you're commonly asked about that you want to make sure we cover?
Well, I get a lot of questions about what type of testing is best for hormones. So if you're coming in to see one of us, how do we establish where you are hormonally? And I think there's a lot of answers to this question. What do you test? Do you test the saliva? Do you test the urine? Do you test blood? How do you figure out where you are on the spectrum of, low, high, whatever? And then when
people that will shift.
Yeah, yes. And in perimenopause, what's particularly helpful is to try to either do a test on day sort of 19 to 21 of your cycle. If you're cycling approximately every 28 to 30 pretty regularly, that's the key time to kind of catch the estrogen and progesterone at their most interpretable time. But I really like to do a urine test that looks over an entire month's worth of hormones, which is every other day for an entire month, so we can plot it out. That way we don't miss those subtle changes that are happening throughout the entire month. So it's called menstrual mapping, and it's a great way to establish where people are with their hormones. It also shows us whether you're ovulating or not. But in terms of testing, I mean, I've always been a proponent of salivary testing. It gives us tissue levels of hormones instead of circulating levels. So when the blood is carrying hormones, you're really measuring the hormone as it's attached to sex-binding globulin hormone, which is a little protein that actually attaches to that. It's sort of like allows it to surf around in the water of our blood. And you really have to take that protein out in order to be able to arrive at a real value. So salivary levels give us a more meaningful level of where people are at the level of the tissue. So that's my personal choice. I also do a lot of urine testing called a test called a Dutch test, which is a great way to evaluate hormones. If you're considering going on hormone replacement therapy and you are perimenopause, early menopause, it's a great way to assess how well your body detoxifies estrogen. And that is a really reassuring way to be able to say, like, I don't have any significant genetic problems with metabolizing and excreting estrogen from my body. Those are tests that we can do off of a urine sample at home that give us a great deal of information about the safety of estrogen in the body. It is not the be all end all. It is not like green flag, red light, but it gives us a lot of information that allows us to say we're going into this with as much knowledge as we possibly can do. So that's a big discussion point, is how do I evaluate this?
So can you tell us more about Vytal Health?
Absolutely. So Vytal Health is a functional medicine online clinic. So we essentially do all of our consultations with people, women, a lot of women, but both men and women, via tele. So just like this, you and I talking to each other, it's exactly how it would look if we were
other people watching.
Right, without other people watching. Right. But it's in the comfort of your home or your office, so you don't have to drive and sit in the waiting room and all those really convenient things. So it is all online. It's all done in a private video session. And we can talk about anything from hormones to thyroid to gut to autoimmune to the whole repertoire of things that functional medicine does a great job with that aren't well addressed in the traditional doctor's office, where you only get 10 or 15 minutes to see the doctor and you're trying to run through all this stuff. So we have a great group of physicians and clinicians in the group. We have 7 altogether. And I know you're based in Illinois. Dr. Vytal Shah, SHAH, is our physician in Chicago. She is amazing with hormones. She's amazing with adrenals. She does a great job with all phases of women's health issues, from having menstrual irregularities and like polycystic ovarian syndrome and all of those types of things, all the way through perimenopause, menopause, and everything in between. So we're really lucky to have her on our team.
And so we have people on from other states as well. What other states do you cover?
We can cover a lot of states. It depends on whether a woman is looking to be on a prescription. That's kind of the rate limiting thing for a lot of us. We have to have a licensed physician who can prescribe. But if she's looking for natural approaches to hormones or natural approaches to perimenopause, or looking for help with nutrition or other approaches to that, we have several really awesome naturopathic physicians who can see patients in a lot of different states. And then we also have a presence up in the northwest part of the country in Washington State, Illinois, Wisconsin. And there's a lot of this is changing. Telemedicine has really shifted a lot with COVID-19. So we have a lot more flexibility than we used to. We just aren't exactly sure how long it's going to last or what it's going to mean for us. But if you think you want to see a Vytal Health physician, you can go into our website, www.vytalhealth.com, and you can actually put your state in, and you can put in the type of physician that you want to see, or you can actually take a symptom quiz if you'd like a little help with that, and it'll sort that for you. It'll help you decide which physician. You could also call us. We can walk you through. 855-998-4900 is our phone number. It's on our website, but you can call us and ask us questions about, I live here, who can I see, what can I do? And we can help you meet your needs there.
All right. And I know you're active on social media as well. So what is the best places to follow you there?
Yeah. So we have an active presence on Facebook and Instagram, and both of those handles are at Your Vytal Health, VYTAL, Your Vytal Health. We are on LinkedIn as well, and we have a little smattering of some of the stuff that we've done on YouTube which if you just search by us, you can find that. But our Instagram and our Facebook are great places to go for information. We post regularly. We post in a timely fashion. We post on a whole bunch of different topics. So it's a great place to grab information. We also have on our website a wonderful blog series that do a great job of talking about hormones, talking about lifestyle, talking about nutrition, gut, adrenal health, all of those types of things. Really great articles in depth with resources and links and that kind of thing. So a lot of information.
So lots of information for people to find.
Yeah, exactly.
Yeah. And so just again, you already mentioned this, but just to highlight again, some of the things you do besides menopause, because I know like autoimmune health is big. A lot of the people that follow me have issues with that.
Yeah.
So could you just cover some of those again?
Absolutely. Autoimmune. We have a wonderful fertility specialist. I mean, the bomb fertility specialist, Dr. Alicia McCovens. Thyroid, a big, big part of our practice is thyroid, because a lot of people are not satisfied when they go to their physician and they get just a TSH and just levothyroxine or Synthroid is their only option for treatment. We do all deep dive into thyroid testing and all types of treatment, from just T4 treatments to combinations to compounded. So we're very well versed in that. Gut health is a big part of our practice. Mysterious stuff that nobody can figure out. We do a lot of that. We have a men's health specialist. I know this is a topic we're talking about today, specific to women, but women have men in their life, and men oftentimes have to sort of be dragged in by their ear. We have a really great men's health specialist that does a fantastic job with connecting with men of all ages. So we have a really wide repertoire. There really isn't too many things that we don't cover, or at least can help with, and if not, a specialty, then help sort of navigate to the right person.
And I guess to that topic, I would encourage you, if you've had COVID-19 and you're experiencing lingering issues, because I'm hearing of a lot of people that have inflammatory types of things that are bothering them afterwards.
Mm-hmm.
To consider talking to a functional medicine practitioner for that, because they're going to have more experience dealing with those types of symptoms.
Yeah, or just recognizing the inflammation load in the body and how to evaluate that. We do have COVID-19 antibody tests that can be done off of a finger stick at home. And so that's something, if you're not sure whether you had COVID-19, you think you did, and you're trying to figure out like, okay, should I actually be thinking about this right now? The first place to start would actually be to get an antibody test and see if you're positive in your antibodies, and then sort of unpack it from there.
Mm-hmm. All right. Well, thank you very much for joining us today.
My pleasure. So great to be here.
Make sure you check out all the resources on vitalhealth.com.
All right.
So one more, as I said, there's one more of these to go. And if you missed the entire series, we talked to a variety of experts. You can find them all on perimenopausalinapandemic.com. This one will be downloaded there shortly as well, but a load of information that you can get from there. Thank you very much.
Thank you, Amy. Have a good night.
You too.
Thanks. Bye.